The LifeChoice Portable Oxygen Concentrator with Auto Mode technology is the smallest POC available for 24/7 around-the-clock use. Unlike stationary home-based concentrators or portable oxygen cylinders, the LifeChoice POC weighs only 4.9 pounds and provides the patient with freedom and mobility anytime, anywhere. Current continuous flow therapies provide oxygen to the patient during inhalation and exhalation. The limitations of this approach are that patients can only receive 24.5 milliliters of a 30 milliliter dose of oxygen while breathing at 25 breaths per minute. This is because oxygen cannot be absorbed shortly after the peak of inhalation, extending through full exhalation at each breath. As a result, an estimated 85.7 milliliters of oxygen provided per breath during continuous flow therapy is lost in retrograde flow. For many patients, this retrograde flow causes nasal irritation and nose bleeding. The majority of portable systems utilize a pulse dose delivery approach. The patient triggers the pulse during inhalation. The pulse dose is delivered at a rate which exceeds the inhalation rate of most patients at 25 breaths per minute. As a result, only 24.5 milliliters of a 30 milliliter dose is typically received by the patient, and the remaining 5.5 milliliters is lost to retrograde flow. Similar to patients receiving continuous flow therapy, the effect of retrograde flow often causes nasal irritation and nose bleeding. The LifeChoice POC utilizes a pulse wave delivery system triggered on demand by the patient during inhalation. Pulse wave delivers oxygen congruent with the patient's normal inhalation rate, so what is delivered is received. At 25 breaths per minute, a full 30 milliliter dose is received with no retrograde flow. In fact, most patients report they can hardly detect the device is working because they do not feel the delivery of oxygen during the inhalation process. Oxygen cylinder tanks can weigh up to 30 pounds and typically require a cart. They are not FAA approved for air travel nor sufficient for overnight use or long periods away from home. Mobility and activity is critical to overall health and wellness of patients with COPD. Unfortunately, stationary concentrators cannot provide true mobility for the patient. The LifeChoice POC is the only POC that will never require a cart. It can be carried as a briefcase, shoulder bag, waist pack, or backpack for 24/7 use. The LifeChoice POC is equipped with Auto Mode technology, which automatically detects the oxygen requirements of the patient during periods of activity, when it is higher, and periods of sleep or rest when it is lower, and adjusts to provide optimal levels at all times. During active mode, the LifeChoice POC delivers oxygen on demand congruent with the patient's inhalation rate of up to 25 breaths per minute and a maximum dose of 3 liters per minute to provide an estimated 28% FiO2 level to the patient. During the sleep mode, the trigger to deliver oxygen is 10 times more sensitive than during the active mode. Patients receive oxygen congruent to their inhalation rate during sleep or rest, and also receive an estimated FiO2 level of 28%. The LifeChoice POC offers up to 5 hours of portable battery life, no carts required ever. FAA approved for domestic and international travel, and the only POC available with Auto Mode technology to detect changes in respiration rate and oxygen requirements during activity and sleep.